Well, so despite the vaccine being available all year, COVID-19 has killed more people this year than all of last year. We're talking 387,000 deaths from the virus in 2021 alone.
Now, that's about 2,000 more than the 385,000 who died last year. To explain what's behind this increase, let's bring in Dr. Amish Adalja with the Johns Hopkins Center for Health Security. Thank you so much for joining us. So, unlike last year, coronavirus vaccines are now widely available. So, what factors would you say are leading to this rise in COVID-related deaths?
The biggest factor is not enough people have taken the vaccine. We've got this safe, effective vaccine that makes you much less likely to die from COVID, which is exactly what the vaccines are designed to do. But you have people shunning them. We have over 60 million Americans still unvaccinated, though eligible to be vaccinated. That's what's driving deaths. The fact that people are actively, willfully not taking the vaccine. These deaths are vaccine preventable.
Sure, but doctor, we do have 195 million people vaccinated. Last year, people were home. They were quarantined. Kids were homeschooling. How do you explain the fact that we have all those factors and yet deaths have exceeded? You know, the talk out there on the internet is vaccines don't work. We've exceeded deaths from last year. How do you answer those?
Even though deaths have exceeded last year's, it's not because something is wrong with the vaccine. The fact is, we have a more contagious variant out there, the Delta variant. This will find you if you're unvaccinated. It is much more contagious than the original strain of the virus or the Alpha variant. So whatever level of vaccination we have about 60% of the population, the full population fully vaccinated. That's not enough when you have a variant that can find unvaccinated people. And these pockets of unvaccinated individuals tend to be clustered in certain geographic areas. They tend to associate with each other, and it allows the Delta variant to rip right through them. All you have to do is look at what goes on in a hospital. And I worked at the hospital this whole weekend. It is unvaccinated people that are getting hospitalized by and large. Very few people get a breakthrough infection that lands them in the hospital. So the vaccines are holding up exactly as we wanted them to. They're preventing serious illness, hospitalization, and death. It is still a pandemic of the unvaccinated, and that's what hospitals have to worry about, is the number of unvaccinated people in their region. And I think it's a misunderstanding to think the vaccine isn't working, because vaccines aren't bug zappers. They're meant to make disease much milder, and that's exactly what they're doing.
And Vermont is one of the most vaccinated states in the country. But millions of people we know will be traveling this week for Thanksgiving, going from state to state. And we're talking about different regulations, maybe different restrictions and mandates. So what impact could this have on the pandemic in the coming weeks?
So it's unclear what the impact will be until actually we see it. But what we do know is that if somebody is unvaccinated, if they're traveling, they're mixing with other people in high-risk conditions, particularly indoors, you're going to see transmission. How much of that happens, I think we'll have to wait and see. If you're fully vaccinated, I think the travel, the gatherings that people are having, I think that's going to be something that can be done safely. I think it should be something that people enjoy, because that's why they got vaccinated. And you can rest assured, if you're fully vaccinated, if you're boosted in one of those high-risk groups, you're likely to only experience a mild breakthrough infection if you do get a breakthrough infection. And that's the goal with the virus that's not going anywhere, is to shift all of the cases towards the mild end. So I think really what we have to worry about is the percentage of unvaccinated individuals that get together and do high-risk activities. And for those individuals, testing, wearing masks is going to be important if they choose to do it.
Dr. Anthony Fauci predicts a dangerous winter spike. Is that unavoidable?
I do think that when it gets colder, when people move indoors, we know that respiratory viruses spread more efficiently, and COVID-19 is no different. So we will likely see cases go up as we get into the winter. The goal is to keep those cases away from high-risk unvaccinated individuals so they don't land people in the hospital and make our hospitals worry about capacity concerns, especially as we see influenza also upticking in the United States. So this is important to remember, is that the virus isn't going to be eliminated. It's not going to be eradicated. We're going to have COVID cases 20 years from now. The goal is to make them much more manageable like other respiratory viruses, and the best way to do that is by having our high-risk population particularly highly vaccinated.
All right, Dr. Amish Adalja with the Johns Hopkins Center for Health Security. Thank you for your time this morning.
Thank you.